Coverage of the 26th annual meeting of the ASMBS is sponsored by Allergan, makers of the Lap-Band AP system.
Hi, this is Leslie Thompson for the Weight Loss Surgery Channel, reporting from the 2009 annual meeting of the American Society for Metabolic and Bariatric Surgery. And I'm here with Dr. Joseph Michaels, a plastic surgeon from the D.C., Maryland, Virginia Metroplex. And Dr. Michaels specializes in plastic surgery after weight loss surgery. So Dr. Michaels, thank you so much for being with us.
Thanks for having me.
Now, I have obviously spoken with hundreds of pre- and post-operative weight loss surgery patients, and one of the most important things on their mind is how soon can I have plastic surgery to get rid of excess skin, to regain a normal figure, especially for women. When is a safe time for them to even consider that after weight loss surgery?
Well, it varies for different patients. Generally speaking, we like the patients to be weight stable for around 3 months. And depending on what surgery they've had, that can be anywhere from 12 months to up to 2 years. There's no really set point. It's just very important for the patient to be metabolically optimized prior to surgery. And so whenever that point is, when their weight's stable, that's a good time to start thinking about a plastic surgery consultation.
Now, I think a lot of people just think of getting a tummy tuck after weight loss. They think, okay, I had this big belly and it's gone now, and so I'll probably just need an abdominoplasty or a tummy tuck. Is that the only procedure that they need to consider? What are some of the most common ones after weight loss surgery?
There are many procedures available to patients after significant weight loss, and it really comes down to what is important to that particular patient. Each patient is individual, and what their ideal goals are is really what the plastic surgeon needs to listen to. The most common areas are obviously the abdomen. In women, the breasts and arms are very common. But many women are also concerned about their thighs, their buttock region. Men are also very concerned about their chest region. So these are very common areas that we see most frequently. Mm-hmm. And there are many procedures that are available to patients, more than just what's considered a paniculectomy or a tummy tuck.
How do you minimize scarring? Because I think people don't want to necessarily trade the excess skin for now they've got scars running up and down their body each and every way.
It's a real concept that patients really need to understand, is that to get the best result, they are really trading skin for scar. And this is a concept that they really have to understand. Surgery can't be done without scars. And really, your genetic determination and your previous scarring is a good predictor of how you will scar with future surgeries, but there's no way to do it without a scar.
Are there ways to hide the scars?
We do try and put the scars in places where it's minimally noticeable, and we do have techniques where we'll try and hide scars under bra lines, under bikini lines, if this is possible. And these are all options that we discuss with our patients at the time of the consultation. Excellent.
Insurance coverage. People struggle to have their weight loss surgery covered by insurance. Some achieve that, some don't. Plastic surgery, is that going to be covered as a benefit at all?
It's a very big question of a lot of our patients, and generally speaking, insurance companies will only help with the abdomen portion, and that's only if it's deemed medically necessary. And each insurance company is different, and each has different rules. So we really recommend you talking to your individual insurance carrier prior to. But generally speaking, medical necessity is what their requirement is, whether they have paniculitis, whether they've been on prescription medications, and documentation of those, as well as the amount of PANIS. These are really the main criteria that insurance companies are looking at. And unfortunately, with some of the other areas, insurance companies are not helping out. However, there are definitely lending services and other financial services that we do try and get patients in touch with to make it as affordable as possible.
So there are financing services, and people can often pay in installments the way they would pay off their car?
Absolutely. We try and make it, these are very important procedures to patients, and unfortunately, the insurance companies don't always see them as medically necessary, although we as physicians know how important it is to these patients, as these are the excess skin and residual fat deposits are really, even though they're not a true scar, but they are a scar of who they once, of who these patients once were. So we do try and make every opportunity available to them to go ahead with the surgery.
Great. Well, Dr. Michaels, thank you so much for your time.
Thank you so much for having me.
We appreciate it. And thank you for joining us today. I'm Leslie Thompson for the Weight Loss Surgery Channel.